Hi everyone, my name is Dr. Noura. Today we're going to speak about hepatitis. Everyone can hear me well? Okay, so we're going to share my screen. Thank you everyone.
Welcome to the session.
Hi, welcome. Okay, so let's start our session. Today is going to be hepatitis. Everyone see my screen?
Yes, it is visible.
Okay, good.
Can you
So
please reshare it? Yeah.
Sorry?
Reshare the screen. PPT is gone.
Yes, I'm sharing my screen. Everything's, can you see my screen?
Your presentation is not visible. It's just your Zoom. So please reshare it.
Okay. Okay. Okay, let's do that. Hi everyone. Okay, how about now? I think everyone seeing my screen right now. Okay?
Yeah, your presentation is visible now.
Okay. Hi everyone, my name is Dr. Noura. Today we're going to speak about hepatitis. So let's start. Okay? So first, what is hepatitis? The definition of hepatitis. Everyone knows hepatitis is infections of and inflammations of the liver. Most time it is due to viral infections. So how many viral we have? So let's do that. Okay, so let's do it here. So we have A, B, C, and D, and E. Okay, A, most of the time, it is acute. Okay, A, acute. B, most of the time is acute and little bit chronic. C, most of the time is chronic. C, chronic. Okay, D, if you're going to get infection with hepatitis D, so it has to be you first have hepatitis B, so then on top of that you're going to have D. Okay, E, okay, it is most common in the pregnant lady. When it is common in the pregnant lady, it is fatal. Okay, so the way I remember that E, okay, it is fatal. Like it looks like the similar, right? E, I called it ethyl. Ethyl, why? Because most of the time it is fatal. It could lead to something called fulminant hepatitis. So to remember that, it is ethyl. Okay, so we're going to discuss that more. So how? Okay, so this is the type of the virus. Okay, so how we can get infection with each type of the virus? Let me clear my screen. Maybe we can go another screen. Yes. How are we going to get infection with each one? So let's do it again. A, B, C, D, and E. Okay. A, watch. A, acute. B, most of the time acute. However, little bit chronic. It is in between. But most of the time is acute. C, most of the time is chronic. D, you need to be on top of B. E, it's more common in pregnant lady. No, it is when it comes in pregnant lady, it is fatal. E, it is ethyl. Okay, so how we get infection with A? A, when you ate something through food. Okay, B, we know hepatitis A and E. Okay, through food and water. B and C and D, it is sex, blood, and prenatal. So the three in the middle share the same. So A and E through food and water. Okay, you ate hepatitis A, you eat hepatitis A. Sound good so far? Hepatitis E, it is the worst fire in the pregnancy, as I said, and it's more common in East Asian. So let's go, and now after we know what is the cause, so now what we discuss, what is the cause. So let's see how it's going to present and this patient, how it's going to come. Okay, so let's have the story. So this patient, okay, he get infections. Let's say he ate something, okay, from outside, he get infection with hepatitis A. Okay, so what's going to happen in his body? So to not understand that, let's do a little bit of the pathology so to make it stick in our head. So first of all, it is a viral infection, meaning he have a viral infection of liver. That's the definition, right? So to make it easy, viral infection, any viral infection is going to have fever, weight loss, and fatigue. because it is a viral. There is no rocket sign here. And it is of the liver. So it is infection of the liver. So to understand what the symptom he's going to present, let's back and understand what is the normal function of the liver. Normal function of the liver, we have many functions, but the main function of the liver, let me clear that first to give it more space. Okay, so what we're going to be having here, the liver. We know liver is clearing the toxin normally. Now I'm speaking now normally, okay? Then we're going to see when you have the viral infection, what's going to happen abnormally. So let's speak first normally. Normally the liver is clearing the bilirubin. We know when we have RBCs, okay, it is a breakdown of the RBCs, this is normal physiology, okay, it's going to get bilirubin. So the bilirubin normally go to the liver, okay, cleared, okay, and get it into the bile and get out with the stool, right? This is the norm. Okay, this is give the color of the stool. It is a dark brown stool. Okay, and what else he have functions? Okay, one of the main functions as well, creating a clotting factor. Okay, clotting factor. We know creating most of the clotting factor is creating in the liver. So to make it just general knowledge, most of the protein in our body creating in the liver. So clotting factor is a protein. So it's creating in the liver. So if the patients have, let me put it in another line. If the liver is damaged, okay, what's going to have? This bilirubin is not going to be cleared. And this clotting factor is not going to be synthesized. So let's see now what is the symptoms going to happen. Okay. So let's see, let's clear it now. Let's see the abnormal. So now we discuss the normal. So let's see the abnormal. I wanted to do blue. Okay. So here's the abnormal now. Now we have the viral infection. This infection, this viral infection is going, let's say it is A, is going to affect the liver. Okay. So the liver cannot pick up the bilirubin. So the bilirubin cannot be picked up. So what's going to happen? This bilirubin, where is going to go in our body? It's going to go to the urine, right? It's going to go to the kidney, then kidney going to be released in the urine. So it's going to be dark urine. How about the stool? The stool is going to be light color, or it's called pale stool, because the bilirubin is not going to be released and cleared through the liver. Okay, so this is the symptoms, dark urine, and it's going to present with the jaundice. What is jaundice? This is our human being that we get affected with hepatitis. Can you mute yourself, please? With hepatitis viral A, so the bilirubin is going to accumulate in his body, so the liver cannot clear it, right? So it's going to go to the kidney.
Hello.
So, hello? Can you mute yourself, please? Sorry. I'm going to answer any question at the end. Okay? Okay. So I'm going to answer any question at the end, okay? But let me finish this.
Check your screen. Yeah, please no.
Sorry?
Your presentation is not visible now. Your chat is visible.
Yes, I know, because I'm looking at the questions.
All right.
Yeah,
So
but
everybody has requested that answers of the questions or queries will be given in the end. So please stay with us. Thank you.
The pathology, okay? Okay, so the patient is having where we are, so infection with the liver, okay? So the bilirubin is going to accumulate. So it's going to go to the eyes, okay? It is basically not the eyes, it's going to the mucous membrane. Okay, when they go to the mucous membrane, most of the time it is the eye, because it is, you can see it in the sclera. Okay, so that's called jaundice, and it's going as well as I said, describe the urine. So hepatosplenomegaly, okay, anything is getting to infections. Okay, this is normal physiology. The cells when get infected is getting swelling, so that's called hepatosplenomegaly, a large of the liver cells. Then one of the virus lead to the nausea, vomiting, abdominal pain. This is most of the time with any infections, viral infection of the GIT symptoms. Okay, you're going to have the present with nausea, vomiting, abdominal pain. Clear? So Let's clear that and repeat it again to make it stick, because this is how the patient present to you. So how the patient is going to present in the scenario. This patient is going to have three parts. The history of this patient is going to be patient either he ate something, or he used a sex history, or he used drug user. Okay, so this is the method of transmissions. Then how is going to present? This patient is going to present, just imagine the virus is affecting his liver. Okay, the liver is not going to function. Okay, so the bilirubin is not going to clear, mainly the bilirubin. Okay, so the bilirubin is not going to be clear. So it's going to present, with the jaundice and dark urine and hepatosplenomegaly and nausea, abdominal pain. This is any GIT infections. Okay, any infection in our body presenting with the fever, weight loss, and fatigue. Okay, so the characteristic is jaundice and dark urine. So when he presents with that and hepatosplenomegaly and abdominal pain, mainly in the right side, you're going to think, I think he had with the history and the clinical symptoms, you're going to think, okay, I think he maybe have viral infection of the liver. So let's do, test. What is the diagnostic test I'm going to do? Okay, so any questions so far with the presentation and method of transmissions? Any questions so far? Let me see the chat box. D is chronic. Can be both. What do you mean that? It can be both. Okay, you mean hepatitis D is chronic. Hepatitis D most of the time on top of hepatitis B. Why dark urine? Okay, I'm going to explain that again. Okay, why there is enlargement of the spleen in hepatitis? Okay, so let's go back. So for the first question, hepatitis D is going to be chronic. So hepatitis D, if you get back, it is on top of B. And as I said, B most of the time, it is acute, and chronic less of the time. So D, to get D, you have to be first having B. Okay, so it's going to be following B, following the same course of hepatitis B. Okay, this is the first question. The second question is why it is dark urine. Again, let me describe that again, dark urine. Okay, and why hepatosplenomegaly? Those are the questions. Okay, we're going to first we're going to do the normal. Okay, so normally, here the normal. Okay, normally this is the human body. Just do it big like that to make space, and this is our liver. You know, we have RBCs, right? We have RBCs in our body. RBCs live 120 days. Okay, after that it break down to the heme and the globin, right? This heme, okay, break down to two things, okay, profringens, okay, but leave it all that, and bilirubin. This bilirubin gets cleared by the liver. So this is normal physiology, okay? Then cleared by the liver it is produced, okay, into the bile, then at the end it gets to the stool. Bile, GITs, okay, then the stool. And this is dark urine, dark stool, right? This is normal physiology. Okay, so now this is the abnormal. We have viral infections coming. When we have viral infection of the liver cannot work well. It is infected, okay? It is swollen and infected, cannot be work very well. Even if it is short term, it cannot be work. So what does it mean? He cannot create the bilirubin, he cannot take the bilirubin. It is like, think about it, it is like, because he is infected, he's sick, he cannot work. Like when we get sick, right? We take sick leave, we don't want to go to work. The same thing with the liver. He says, like, I want day off, I don't want to work. Okay, when the liver is not working, however, the bilirubin is creating from the RBCs. It's going to be accumulating in the body. Where is going to go? Okay, it's going to go to the mucous membrane and to the urine. Have to be get released. So it's going to get released through the kidney and the urine. Bilirubin, it is dark. You have this color. It is dark. Okay, the bilirubin, it is dark. Okay, so when we have, it is like, think about it like it is a dye. Okay, it has a color. It is have a dye. Okay, so it's going to give the urine dark color. Okay, is that clear? For the doctor, he asked me why, but how spleen enlarged? Yes, ma'am. Okay, good. So I'm going to explain the spleen, but spleen again. Let's get back. Clear that as well. Okay. Okay. So now we put the normal. Then the easiest way to understand, when I was in medical school, I hate memorizing. Okay. So the easiest way to understand everything to get back to the normal physiology and pathology. So that make you easier to understand how the disease work. So it make everything make sense for you. Okay. So because that I love to go back to the normal. Okay. So let's get back. Okay. This is our body. Okay. So we have here the liver. Okay. We have here the spleen. Okay. So if we get back, very back, okay, it is a little bit of about physiology, normal physiology. You remember we have something called lymphoid tissue, and those tissues, okay, they react to the infections. Okay, so for instance, do you know something called? I think everyone familiar with that, Epstein-Barr virus. Okay, this is caused pharyngitis, and it's as well causing what enlargement of the spleen. So there is certain infections in our body. So, okay, let me get back as well. Okay, but more back. So when we have any infections, let me clear this. Okay, let me clear this. But I think this is important to understand. So we have, okay, this is our body. So any infections, okay, come to us. This is normal. Okay, I'm speaking now normally. We have defense system, right? Immune system, defense system. One of the defense systems that we have in our body, it's called lymphoid tissue. When we have this lymphoid or reticular endothelial cells and this lymphoid tissue, we have them in the lymph node. And we have the same in the liver, in the spleen and liver. Why? Because any infection is come to our body, all this response. Why the liver involved in these conditions? Because most of them protein, okay, like fibrinogens, okay. You know when we have infections, okay, and you see in the world they measure something called C-reactive protein, okay, right? So this is creating from the liver. Why the liver create that? How he knows that? Because the liver is one of the defense mechanism in the body. Okay, so what is the general concept? Is the liver is part of the immune system. Why? Because he creates all the defense factor, C-reactive protein, fibrinogens. And if you, in normal practice, we measure that when we have infections. From where this come? They come from the liver. Okay, so why the liver is doing that? Because he's part of the defense mechanism. So when we have infections, as well the spleen, some infections, they get splenomegaly, like Epstein-Barr virus. Okay, it gets, infectious mononucleosis. It gets infection mononucleosis when you have pharyngitis. Okay, as well, we having enlargement of the spleen. Why? Because spleen as well, part of the defense mechanism. So when we have viral infection of the liver, okay, hepatitis A or hepatitis C, whatever hepatitis, it is viral infection. So this part of the defense mechanism. So we get hepatosplenomegaly. So, but the spleen is not most of the cases. Okay, but mainly in the liver. We get splenomegaly, hepatomegaly, okay, mainly, and most of the cases, spleen as well. But it is not, it is makes sense because it is part of the defense mechanism. That's clear. If it is confusing, drop it. Okay, that's clear. Yes, sounds good. Okay, so it is part of the defense mechanism. Good. Okay, good. Sounds good. Okay, so let's go back and complete it. Guys, just I would like to emphasize this. You don't require to understand all that, okay? So in your exam, in Plab exam, they don't ask that question about pathophysiology or physiology. They just presented a case where the patient come with like for instance, a drug user, he come with the symptoms, and it is there is not including pathology and pathophysiology. Why I'm explaining that? I believe when you understand the pathology and the normal physiology, it makes sense for you to understand the disease, how it's affect. Okay, but if you feel like this is overwhelming, just drop it. Okay, just you need to understand that fever, jaundice, dark urine, hepatosplenomegaly. Okay, with the history of drug user or eat something, I suspect hepatitis. That's what you need to know. Sound good? Is anyone confusing here? Okay, no one confusing. We are good? Okay, good. So let's go and clear this. Okay, so now we're getting back to our patient. Okay, let's name it John. So John, he came with we have two patients, John and Alex. Okay, John, he eats something, okay, when he was traveling abroad, and Alex, he is a drug user. So both of them, they have present with the same symptoms. How I'm going to suspect? They coming with the jaundice, fever, abdominal pain, nausea, and vomiting. Okay, so how I'm going to say, okay, now I suspect hepatitis, right? So how I'm going to differentiate, okay, which kind of hepatitis, because every kind of hepatitis, okay, of the viral, have different tests based on the history. So here the part of the history is coming very important, okay, because I have how many types? I have hepatitis A, B, C, D, and E. So the symptoms is the same. However, to do diagnostic test, okay, I need to be more specific. How I'm going to know which type? This is from the history, okay? So this is going to be in all of them. So basically, patients come with the symptoms. I'm going to do viral. Increase direct bilirubin. That makes sense. I explained that. Increase ratio of alanine, ALT, to AST. Okay, what is this ALT and AST? This is liver enzyme. Okay, just consider this is the liver. Okay, to work, you have enzyme inside of it. Okay, so when you have infections, okay, it's like it's all this enzyme is leaking out. Just think it's become broken. When anything is broken, everything's leaking out. So increase the ratio of the enzymes. Increase alkaline phosphatase is as well one of the enzymes in the liver. Okay, all that inside the liver is going to be increased. So what is the rocket sign here to differentiate between every type of the hepatitis? Let's do that. Okay, so we have questions here. The question is asked here, which the following is the best with the increased likelihood of the mortality with the liver? Okay, so patients come with the hepatitis. Let me do it like this. Okay, symptoms. I took the history. He came with the symptom of hepatitis. Okay, fever, jaundice. Okay, abdominal pain, dark urine. Then I did normal liver function test lab. Okay, everything is high. Okay, which is the test? When I do it, I see, oh, this case is very likelihood to be mortality. It's like me, most risk one. Which test? Any idea? Bravo. Yes. Yes. It's the BT. Thank you all. Why? Okay, so let me do a little bit of explanations here. Prothrombin time. You remember I told you the liver have many functions. Okay, one of the function is creating all this clotting factor. Most of the clotting factor, not all, clotting factor. Okay, when the liver, it is increasing the bilirubin. This is happening most of the time with any type of infection, even if it's a slight infection. We see jaundice, right? Even some people, when they have exhausted, okay, they just have high bilirubin and high liver enzymes. That's not having with minimal infections. However, clotting factor is a protein. When the liver is mean, it's creating in the liver. Okay, so if the liver is not functioning, okay, most of the liver is not functioning well, that means he cannot creating the protein, clotting factor. So the prothrombin time is going to be prolonged. Okay, this is increased, like cannot be clear. It's happening with anything. ALT and AST, just I consider it how I consider it, how I visualize myself. It is the liver having a border. Okay, I see it like that. The border is keep all that inside. When the border is just open slightly, okay, all this just leak. However, affecting clotting factor, that's not going to happen with minimum infections. That means there is the liver cell cannot be functions because that is cannot creating a clotting factor. That means it is a big infection. It is a big affecting impact on the liver. Okay, because that cannot creating the clotting factor, so the prothrombin time is prolonged. Okay. Any questions so far for this point? Okay, thank you. Thank you. Okay, so let's proceed. So the answer is B, and I explain it, okay, for you. Okay, so now how we diagnose. So before we go there, let's get back. Guys, think about it as a patient, okay? When you think like as a patient, I think it is making more sense, okay? So what is the scenario? This our patient coming to us, okay? This patient coming to us, okay? He said, doctor, I have jaundice, I have dark urine, I have fever, I have abdominal pain. So we suspected what? Hepatitis, right? We did what? Liver function test. We found the liver functions, bilirubin high, AST, LT high, alkaline phosphatidate, everything is high. So now I have to think what type of the viral infection is, right? It's hepatitis, but which type of hepatitis? So from where I'm going to know this question, the answer for this question, from two parts. Okay, first part is the history, right? So I'm going to ask him, for instance, John and Alex. Have you traveled abroad? Have you eaten anything, okay, from outside? Okay, why I'm asking this? I'm suspecting A or E, because they came from food, right? So I'm going to ask him what other questions. Do you have any, do you do any unsafe sex? Do you have drug, are you drug user? Okay, if she's a female, okay, do you take any old vaccine and necessary, because we do that normally during pregnancy to protect the child, okay? So we're going to ask these questions, B and C and D. Okay, so now I suspected for it is this patient is John. I suspect it is A or E. What I'm going to do next to confirm, I'm going to do immunoglobulin M and immunoglobulin M here. Okay, D and E as well, I'm going to do the same. Immunoglobulin M. B, the only one is different. Okay, why is it different? I'm going to discuss that at the end. C, most of the time we say it is chronic. So you see few people, they do IgM. Why? Because it is most of the time it's chronic, and IgM it is acute. How about that? Let me one step further. Yes. Guys, any question I'm going to answer at the end of each part, okay? So let me finish explaining this diagnostic test. I'm going to answer our question at the end, okay? So I'm going to clear that. Sorry. Okay. So let me go one step further, okay? Okay. Normally, here, come on, normally, when this is a human body, when he get infections, okay, defense mechanism of our body, our immune system, what is creating? Okay, creating first response IgM. IgM, it is for acute. We know that, right? Okay, and if it is second time, for instance, this is for second time, it's creating IgG. Okay, this is normal physiology in our body. So what is the scenario here in hepatitis? Okay, when we have A and when we have A and C and D and E, the best initial test is going to be immunoglobulin M because acute infections. However, as I told you, immunoglobulin G is going to be to detect resolution of infection because it is coming chronic. It is after, I think, 14 days. Okay, because any antibodies, the lifelong for antibodies is 14 days, so around 14 days. Okay, we're going to do again immunoglobulin. So it's going to they find IgG. Okay, so this is for A and B and C and D and E. However, C, it is most of the time chronic. What does that mean? So let me give you get back, explain more. C, when you have infection, this is the person. Okay, let's see. He's doing tattoo. Okay, so he get infection with hepatitis C. So it is most of the time silent. Okay, I do it like this, silent like this. Why? To remember it. Okay, he doesn't have that serious like the symptoms. So most of the patients, they don't recognize they have acute form. So they came, okay, even discovered it accidentally, or when they have symptom of a chronic. So when it is chronic, how we can detect the hepatitis C? We do something called BCR. What is the BCR? BCR basically, hepatitis C, it is RNA virus. So we detect the RNA. Okay, how we detect the RNA? Through something called BCR. Detect the RNA. We have something called DNA virus, and we have something called RNA virus. Okay? Okay, so here is RNA virus. It is the code for everyone. Like human being, we have DNA. Some virus have DNA, and other virus have RNA. So he is RNA virus. How we can detect this RNA? Through something called PCR. Okay? Why is this important? If someone having hepatitis C, okay, he's not, so the key part is going to see how much RNA virus have. Why this is important? Okay, so human being, okay, to understand that, we have DNA. Why we have DNA? DNA, it is to replicate cell, right? When we have one cell, want to be two, okay, we just divide the DNA, right? This is the chromosome. We divide it to two, become replication. This is normal physiology, right? So in the virus, the same. We detect they have RNA. This hepatitis C virus have RNA. If you want to replicate this virus, become more, this RNA is going to be more, replicate more. So I'm going to detect the amount of RNA to see if this virus getting replicating inside the liver or not. Why? Because it's going to replicate and become more. That means he is active, okay? And mean he's going to lead more damage of the liver. Okay, why this is important? Let me clear that. Okay, I'm now describing hepatitis C. Okay, so let's getting back to not to get confused. Okay, so the patient, we have Alex, John, and Alex. Okay, John and Alex. John came with A and E. Alex came with the B, C, D. Okay, they're drug user. Okay, and we have, let's see this John and Alex, and what is the other patient? What we name him? That's a 2-1. Let's name him Mike. Okay, so both of them, they came with the symptoms. Okay, both of them, they came with the symptom jaundice, dark urine, abdominal pain. Okay, I did liver function test, everything is high. What I'm going to do here, okay, here I'm going to do immunoglobulin M to confirm. It's going to be A or E, okay? B, I'm going to describe it later on. Okay, if it is C, that's Mike coming with, he's doing type 2 history, he have a type 2, he doesn't feel well. He, most of the time, is not going to come with acute. I told it a little bit to come acute because it's silent. Most of the time, it's chronic. Hepatitis C, most of the time, chronic. So when he come to us, okay, what I'm going to do something called BCR. Why? Okay, to detect RNA. What is the RNA? This is the like a DNA. Okay, this is the viral replicate inside the body. Why is it important? This is the liver. Okay, liver form with something called hepatocyte, right? This is the cell, other cell, and like that. Okay, when we have this viral lead to replicate, and it's going to damage the liver and lead something called fibrosis. Okay, fibrosis, because viral infection lead to fibrosis. This fibrosis is called cirrhosis. So each part getting fibrotic, okay, is not going to work. So I would like to limit this viral replications because I want to save this liver. Because the more you get infection, the more it's getting fibrotic. So this is the most important part. The most important part in treating hepatitis C is not to clear hepatitis C, is to make it the viral load is low. Why? Okay, because I don't want it to replicate. I want to save the liver. Okay, replication means more virus, more active virus. Sound good so far? Any questions? Why, what is mean by resolution of infections? No more infections, he become well. Like when you have hepatitis A infections, okay, he get this infection for a while, hepatitis A and E most of the time is just self-resolving. He's not going to have any infections. It is rarely, to be honest, we do IgG, rarely. But some people, they do it, but it is rarely because the patient will become well. He's not going to have symptoms, not necessary to do IgG. Okay, sound good. Okay, so now we finished what? We finished A and E. Let's finish A and E. Let's finish that. Okay, so A and E, sorry. Okay, we are here. A and E, the results continuously over a few weeks. Okay, it is benign condition. Hepatitis E, I told you, if it is most severe in the pregnant women. Hepatitis B, I'm going to speak about that. But we finished A and E. A and E, it is John. It was John, yeah. John, he ate something. So he will come with the symptoms. Okay, we're going to do liver function test. Liver function is going to be high. We want to do more diagnostic. We're going to do IgM, sorry. So it's going to be a high for hepatitis A. Then it's going to be okay, resolves continuously. E as well, the same. However, it's going to be more severe when it is pregnant. Just take care of that, okay? Hepatitis C now. We are speaking about hepatitis C. B, I'm going to do it later on, okay? Hepatitis C, the patient with tattoo, Mike, okay? He's chronic. When he first have infections, he doesn't feel anything. Now he have developing symptoms. Most of the time he's chronic, okay? What I am going to do, did liver function test, everything is high. To detect that, I'm going to do PCR, we said, to detect viral level. Okay, so my aim, okay, when I detect PCR viral level, my aim, I said, to keep this viral load is low, right? So how I'm going to treat it? Okay, let's go to the next slide. Treatment of hepatitis C. Leave hepatitis B. Okay, we're going to go hepatitis, C. Okay, so to detect hepatitis C, I did viral load. Okay, said I have certain viral load is high, and I have viral load low. If I have viral load low, my aim is to keep it low. If I have viral load is high, okay, the second step is to take a biopsy. Why? Because I have to do biopsy to see if there is fibrosis or not. Okay, so if it is have a fibrosis and viral load is high, so this indicates there is active viral replication, and we have to start treatment urgently because it's going to progress to cirrhosis. Okay, that's clear. I described that. I explained that it's like any viral, when you get it, is leading to replicate. When you replicate, it's going to damage this liver cell. What is the meaning by damage? Meaning is going to lead to fibrosis. Fibrosis is not going to work with this liver cells. Okay, so it's fibrotic. What we call that cirrhosis. So if the viral this is like, for instance, 80%, okay, and the viral load high, that means it's going to end up at 20%. So I have to give treatment immediately. Okay, so this is treatment of chronic hepatitis C. If there is fibrosis and the liver biopsy, initial treatment become more urgent, okay, to prevent hepatic insufficiency. So the goal of the therapy is to achieve undetectable viral load, to remain undetectable after the therapy ends. How I'm going to do that? Through PCR RNA viral load, okay? Any question regarding hepatitis C? Okay, any question? Clear, sound good. Okay, so this is hepatitis C. So we finish A, leave B, C, and D, and E. Okay, we finish A, C, D is going to be on top of the B, and we finished D. So let's go back and see B. Okay, so when you go to B, okay, to understand B, okay, we finished here. So hepatitis B virus. So what's his name? I think he's what, Alex. Okay, so Alex is a drug user. Okay, he came with acute symptoms. Okay, jaundice, liver, right side of abdominal pain, nausea, vomiting, dark urine. And we did liver function test, every liver function test, everything is high. What we going to do next? And he is drug user. So we suspected what maybe going to be B. So what is the next step, what we're going to do? Okay, the more diagnostics test. This is the question. To understand that, let's go and study hepatitis B virus, how it look like, okay? Hepatitis B virus, it look like that, okay? We have something in his service, okay? It's called service antigen, okay? We have then the core, that you see like that, and this is the DNA inside. It is a DNA virus. And the hepatitis C, it is not DNA, it is RNA. So that's different, what I told you. Some virus are DNA, some virus are RNA. Okay? Okay, so we have at the surface, we have this surface antigen, we have core, and we have inside the DNA. Okay? So this is how it looks like. Why this is important? Because when this virus gets into the body, let me clear this. Okay. Yes, any questions about C? No, nothing? Okay, so I'm going to start now to describe and explain hepatitis B. Okay, any question, leave it to the end, okay? Where we are, hepatitis, okay, so this is the human, this is Alex. He gets infection with hepatitis B. So this is the viral inside his body. So what's going to do this viral? When it is coming inside of his body, okay, and the liver is going to release the antigens. So the defense mechanism, so this is the immune system, is going to defend the releasing antibody. So the first antibody is going to be against the surface antigens, okay? It's going to be antibodies, we call it S antibodies, okay? Okay, however, when we want to know this patient have infection, because this making this antibody take up to 14 days, okay, 14 days. We want to detect if the patient having infection or not. We're going to measure hepatitis S antigens. So if you have infections, we're going to measure if you are having S, okay? If you having recover, that means you're going to have the antibody. Why that mean? Going to be a war here, okay? When this war is going to end, we're going to form this antibody. The antibody is going to be more, and the antigen is going to be cleared. So that means you are recovered. When you have the antibody of S, what that means? Victory. Victory sign, more antibody, less antigens. So if you detect that, it is a victory. Okay. What else condition we have that the antibody when we give it for the patient? Why? We vaccinate them. But when we vaccinate them, we're going to give them the antibodies. That's what we get to vaccine. Okay, let me repeat that, because this is the most important, I think, confusing for most of the students, okay? Okay, so this is the virus inside our body, inside the patient's body. Okay, so this is the Alex. Alex gets this infection. When you get infection, first thing, normal, immune system is going to react for that. How this immune system is going to react for this infection is going to create antibodies, okay? This is how he defends. He's going to create antibodies. Creating antibodies, when we takes time and it become more when it is less antigens, okay? Because the antigen, okay, it is destroying the antibody. However, if you have more antibody, less of the virus, that means victory. So when you detect that, that means recover. When you detect the S antigens, okay, that means it is infectious. So what else we have the antibody as well? Just antibody without the antigen when we vaccinate the person. Okay, so let me get back to let me clear here. Okay, we have another antigens. Let's get back to this slide here. Okay, so we have the core. So let's step by step. So we have acute infection of hepatitis B. So when you have acute infection of hepatitis B, we're going to have S antigen. You understand this now, right? As well when you have a chronic. Why? Because you still have infections. It is infections mean. Okay? So what about the antibodies? When you have the antibodies, it's the victory sign. So we mean clear. Understand that now. Or vaccinated. You understand that, correct? So let me speak about the E antigens, okay? Okay, the E antigens. What is the E? Hepatitis E antigens, okay? How it describe if you are infectious to other, okay? E infectious. How I know? How I make it straight in my head? If you are infectious to other, like for instance, okay, this patient have get infections, okay? I want to see this patient is going to infect other person or not. What I'm going to measure? I'm going to measure how much E antigens he have. How I know it that, how to make it straight in my head? E, it is from envelope, right? E envelope. I'm going to see if Alex, okay, is going to send his infection in envelope to Sarah. E for envelope. It's just analogy to make it straight in your head. E, it is to send an infections. It's not about you are infected something. It is infect S. You are contagious for someone else. That means E. Are you going to send it in envelope to Sarah? Sound clear or confusing? Clear? Yes, sound good. Okay. Okay. So this is about E. Okay. It's clear now. So E, sorry. E, okay, it is if you are going to get infected to other person. Most of the time when you are acute, you are infected, contagious for someone else. List with the chronic. Okay, less with the chronic, but most of the time with the acute one. Why it is less with the chronic? Because the viral load, even it is between low and high, but most of the time is low. Okay, but here when it's acute, the viral load, it is most of the time is high. What is the viral DNA? If you get back to the slide, this is the viral DNA. This is, and why it's going? Where is this? Sorry. Okay, this is the viral DNA. Okay, and what we said earlier, do you remember? We said the DNA, it is how the viral replicate. So when you have first get in the body, the virus become active. You want to replicate fast. So it become very high viral replication. It is division of the viral. This is the mean viral DNA. When it is chronic, because it is chronic, it is replicating but slow. Most of the time it's slow. So the viral DNA is low. The number of the viral DNA is low. Okay? So that is what is here about the viral DNA. Okay, of course, there is no viral DNA, clear and not vaccinated. Okay. Okay. So there is something. So we said about that. This is we rarely use antibody for E. Okay, but it is makes sense. It is going to be present even with when it is clear sometimes. Okay, because the antibodies presenting of the antibodies mean the immune system is when. Okay, why? Because antibody become high. That means immune system, okay, is working very well. It is overcome of the antigen. Antigens come from the virus. So when you find antibodies, that means you're going to find in the cleared. Okay, those people have very strong immune system. This is the victory sign. Antibody is the victory sign. Victory sign. Okay. So let me speak about the core antibodies. Okay. So let me speak about the core. Okay. Okay. Let me get back. Oh, I can do it here maybe. Let me see if I have room here. Let me clear it. Okay. Or maybe I have more room here. Yeah. Where is the core? This is the core. Okay, to understand where it's come from. This is the core. Okay. This core, okay, we having antigens and we have antibody. Let me clear here. Sorry. Okay. We have antigens. This is antigen for the core. And we have, this is the human body. This is the human body. When any antigens, when any viral coming, it's going to do defense mechanism. The defense mechanism is creating antibodies, right? So when I have the antigens for the core is high, Guys, what is the antigen? The antigen is a part of the protein, part of this virus. Okay, we just detect the part of the virus. We cannot detect all the core. So detecting any part of the core, we called it antigen, a part of it, right? So when we detect this part of the core, the antigen, most of the time is acute. Okay, so when we as well detect the antibodies, because once it comes, okay, the body is going to create antibody. So we can create that in the acute form, as well in the chronic form, because this antibody sometimes is still to have that. Okay, so breathing of the core, this is the core. So we're going to have the antigens in the acute form. Okay, so let's go back here to our slide. Okay, we have the core IgM in the acute, because we say M, it is within the 14 days. IgG antibodies is going to be in the acute and the chronic and even in the cleared. Why? Because this is antibodies. Okay, this is signs of the victory. So you can find it in the acute, in the chronic, in the cleared one. So the core is not to diagnostic. The most important one to diagnostic is the S and the E. The E to detect the infections and the S to see if it's infectious or not. Okay? Sound good so far? Okay. So why we use this core for? They use this core to differentiate between someone he is being cleared and someone he's been vaccinated. If you are vaccinated, you're just only going to have antibody for S antigens. Okay. However, if you are someone who is cleared, you're going to keep this core forever. It's going to be, you're going to have two victory signs, the core sign and the S sign. Okay. So if you have when your immune system win this war, you're going to have two victory signs. What is the two victory signs? For the core and for the S. If you're vaccinated, we give the patient, we give them antibody S. Sound good so far? Okay, I'm going to do summary for that. I think in low viral load, hepatitis E present, would it still be contagious? Hepatitis E? Low viral load, hepatitis E. You mean B, right? Or E? E present may only infections or contagious or what? What you mean? And okay, I get you. E antigens, okay. In low viral load mean E antigens in low viral load. Okay. E, let me, sorry. Here, okay. I think, let me do summary. When we do summary, I think it make it clear for everyone. Okay. Sorry. Okay. But before we do the summary, let me go to the next slide. This next slide is told you that sometimes we have something window. So what is the window? Between the acute infections, okay, they're going to be relapsed, okay? So we have this window phase. In this window phase, what is going to be positive? It is the core antibodies. Okay, so this is when the antigen getting low. Okay, so if you suspect patients having hepatitis B infections, okay, for Alex, okay, then the viral hepatitis S antigen is low. Okay, however, in this time, what is going to come positive? The core is going to be high. But which core? IgM is going to be high. So we use this core to cover the window phase. Okay, so let me go back and do summary to make it understand well. Okay, here. Or maybe we have an, okay. Okay, so maybe go back here, make it more space. Okay, let's start. How many antigen we have? We have S antigen. We don't have core antigens, okay? we just have antibodies for the core. Okay, and we have E antigens. S, you are sick. Do it like this. It doesn't matter. Viral load high, viral load is high, low, doesn't matter. Okay, you are sick. You have S, you have the viral, you are sick. Clear? Okay. So the next question is going to be, okay, are you contagious or infectious to other? Okay, or not? This is the next questions. We're going to see E. Are you going to send an envelope your infections to Sarah or not? This is the question. We're going to see the E. Okay? Why I'm saying that? Because patients, okay, maybe having S antigens for 1 month. Okay, when he proceeds to 6 months, he's going to be chronic. How are we going to decide he's chronic or acute? He's going to have this antigen S for more than 6 months. The next question is going to be, are we going to isolate him for that more than 6 months? No. When we decide we're going to isolate him or not, we're going to decide based on the antigen E. Is he sending envelope to Sarah or not? Okay? This is the most important part. Is that clear so far? Okay? Sick, regardless your viral load high, it doesn't matter. You are sick. Okay? Regardless your viral load. Because that we use S antigen to diagnose, not the viral load. This is the most important. Okay? Is that clear so far? E antigen and low viral load. Yes. Okay. So it doesn't matter. The most important is S. Okay. So now we're going to take further steps. So if it is having that before 6 months, it's acute. Have it after 6 months, it's chronic. Okay. Having the S antigens, that means you are sick. Okay. Having the E antigen, that means you have envelope to send to other. Sound good? Okay. So sorry. So now what is wrong? Let's clear that and see. Oh, this is the antigens that we have in the hepatitis B. 2 antigens, E and S. So now let's start with our body. This is the human body. Human body creates 3 types of antibody. Okay? He have antibody against this S, and he have antibody against this core. Okay? When we have antibody against the S, okay, that means the human body immune system is winning. Okay, and this is low, so he is winning, having more antibodies. Okay, that means you have been 2 things: either you are vaccinated, I give you that, or you win this war. To differentiate that, I'm going to have the C. If you have the core with the S, you have 2 things to prove you have victory. Okay, if you want to prove this patient have victory, you win this war, okay, you have to have 2, C and S. Okay, how about the patient if he have just antibodies, S antibodies? That means I give him that. Okay, he doesn't have war, I give him, he comes to the clinic, I give him S antibodies. Okay, this is the vaccine against hepatitis B. Okay, so 2 victory. However, what kind of hepatitis B? Antibodies, core antibodies. We have 2. We have IgM and we have IgG. If I have IgM, it is present within 14 days of infections. This doesn't mean you have when. No, most of the time you have acute infections. You still just 14 days. Okay, what mean if you have IgG? You have 2 stories. Either you become chronic, or you have victory sign. But most of the time you have, okay, it's important for us why. It doesn't matter, okay? It matters to differentiate between vaccinated and between if you have when. And the second one is important for us is the IgM. Why? Because what we said here, okay? Sometimes the infections, okay, the hepatitis S antigen become high. Then it drops. Okay. However, at that time, what is going to be high? The core antibody. From where this core antibodies come? From where? Okay. From where this antibody is created? That means you get infections and the body creates immunoglobulin M quickly within 14 days. So let me tell you how I consider that. I consider that this is the virus, okay? And this is the body, okay? The virus enters the body. Then he hides. But when he hides, he left something. What is the sign that we can catch him with? It is the antibody that he created immediately, the core antibody. You get me? So he just think about it. He hide the virus. Hide. He went somewhere and hide because he's get low. But that means no, he is still here because we have the core. From where you get the core? We do not vaccinate it with the core. From where you get the antibody for the core? Because you have the virus. So we call that it covered the window. Because the core, this is the core, guys. When we get vaccinated with against hepatitis S antigen. We don't get vaccinated against the core. So if you have antibody against this core, from where you get this antibody from the core? Unless you have the infection somewhere else and become high, it's hiding. Is that clear? Yes? Everyone clear? Everyone? Okay. Okay. So let's do last wrap up with this, because this is the most important part, I think, about all this hepatitis. And there is nothing with the treatment of hepatitis. So let's go back to our here. So, okay. So what we said here, here, the S antigens, it is the acute, it makes sense. And the chronic, if it is more than 6 months, right? And the antibody, this is the victory sign. The victory sign, either you have been cleared, victory, one victory sign, or you've been vaccinated. How I'm going to differentiate? If you have cleared, okay, or recovered from hepatitis B infections, you're going to have the core antibody. Okay, this is 2 victory sign. Just make it like this, 2 victory sign. E antibody, okay, it is E antigen, sorry. E, it is the envelope that you're sending to other people infections with. Most of the time in the acute, sometimes in the chronic, but it's most of the time in the acute. But if you have it, you mean you need to isolate yourself because you are infectious to other, you are contagious to other. Okay. Okay. And the antibodies, it doesn't matter. Okay. Don't okay, it's not important. Viral load, okay. This is we use that most of the time to treatment, not to the diagnose. To diagnose, this is the key. Okay, this is to treatment. Okay, so we use this. Okay, how about the core? Okay, immunoglobulin M, it will come in the acute. This is what we use to in the window. Why? Because the virus enters the body, then he's going to hide somewhere. However, if I found immunoglobulin, why it's not right? Immunoglobulin M against the core. Okay, that means okay, this is the what do we mean? The trace that he left. Even if he hide, you left something here. So I can see, okay, this is having in the window is acute infection. Okay, and in reality, we don't describe each one. We describe all viral. So we describe, we order all this viral test. But it's good to know when you see the result, okay, what does that mean? To interpret good, okay? So having immunoglobulin M, it is in the acute. And G is going to be either acute, either chronic, even clear. It doesn't matter, but it is important it is one of the 2 victory signs. So the important part, it's the acute here. Why? Because it's covered the window phase. And here in the cleared, why it's important in the cleared? Because it is one of the 2 victory signs. But here it makes sense as well. It makes sense, right? He is along with the infections. Okay? He keep all the time. Okay, he is when you get to the body, immunoglobulin G is going to be high forever. Okay, the core antibodies. Okay. Any questions so far with the vaccine? Sorry, with the antibodies. Ma'am, if E antigens present but low viral load, would he be still? Yes, guys. The most important part is the E. E is infectious. E is envelope. Okay, viral load, not necessary. Okay, E. Okay, indicate is E. Okay, viral load. Okay, the most important part for the treatment. Why for the treatment? I'm going to describe that in a minute. Let me say it here. Because the more viral load, what I said, it's going to lead more fibrosis. Okay, so it is okay. What type of the treatment you choose? You're going to do high treatment, one regimen, two regimen treatment. That's the most important of the viral load. Let's go to the next slide. So we finish how to diagnose. So here are the questions. So what is the following? I think everyone knows this answer for that. The first, acquiring hepatitis B. What is the answer? Bilirubin, E antigen, surface antigen, core antibody, T, and hepatitis B antibodies. You have to answer that correct. Okay, I'm going to. Guys, what is the answer for these questions? Which the following will become abnormal first after acquiring hepatitis B infections? E antigen, surface antigen, core antibody, ELT, and hepatitis B E antibodies. Yes, hepatitis B E antigen. Good. Yes, that's correct. Okay. So what's the treatment? And this is okay. Here the treatment. Okay. So now this is Alex. Let's see on the blue. So Alex, he is a drug user. Okay. So Alex presents with the jaundice, abdominal pain, nausea, and vomiting, and dark urine. We did liver function test. Liver function test is high. Okay, then we did viral. Most of the time we do it together, by the way. Okay, we did viral. Okay, we found he has acute form of hepatitis B. He have high antigens S. Okay, so the infections is depend. Okay, so he had that more than 6 months. If he had more than 6 months, we said we're going to be having surface antigen more than 6 months is going to consider it chronic. Okay, so see, this is the viral load. If this patient have positive E antigen with elevating level of DNA polymerase, treatment is any of the following. So it is affecting the DNA level, it's affecting the treatment option. You're going to say VAR, this is VAR, entecavir, adenovirus, lemonavir, interferon, or any of this treatment. Because interferon injection has most adverse effect, it's the worst choice. So the DNA levels, okay, it is controlling which medication regimen you're going to choose, okay, but doesn't mean it is controlling if this patient infectious or not, okay. It is most important for the treatment regimen because the more viral load, the more it's replicating. The more replicating, the more is leading to the fibrosis. Okay. Okay. So here as well, the presence of fibrosis in biopsy is a strong indication of begin therapy. We do that with hepatitis C. I described hepatitis C as well, hepatitis B. So biopsy is important for hepatitis B and C, but with the chronic infection, basically. Any chronic infection, we do viral biopsy if the viral load is high. Why? Because chronic, that means the virus is replicating. It's leading to fibrosis. Fibrosis means liver function is not going to, the liver cell is not going to work, the hepatocyte is not going to work. So that's going to lead at the end to cirrhosis. And cirrhosis, there's no, it's irreversible. So what we're going to do, we want to prevent that from happening. We want to control that. We want to make the viral load is low. Okay? And that's the end of the sessions. Any questions? Any question, guys? Okay, I will ask a question, but then. No questions? Okay, let me ask a question. What question we going to ask? Thank you. Okay, let me ask a question then. Okay, what is question going to ask? Okay, so patient present with you. What is which test to cover the window phase? window phase. Which test, if you find it high, that means patient have infections. However, he is in the window phase. Guys, come on. Don't let me repeat that again. Window phase. Window phase. Huh? No? Okay. Window phase. I think maybe I didn't stress that enough. 1 minute. What I mean by window phase. Here, guys. Sorry. Here. Window phase, this is me. We get the virus, this is the human body. Sorry. This is the human body, okay? He get the virus. It become high. The virus high. At the beginning, it's become very high, right? Then the virus getting hide. However, it is hide inside the body, okay? He's still in the body, but is hiding, okay? But become low, okay? So I want to see if this patient still have hepatitis B infections or not. He is a drug user. He come with the symptoms. He's Alex guy, okay? However, he doesn't have E, but he have what is going to be having here high. What's going to be here high? That tell me no, the virus is here, but it's hiding. Yes, cool. Yes, good. IgM. It is IgM. Yes, IgM. Because it is recent, acute, okay? Acute, it's not IgG. IgG, it is in the chronic or in the recovered. This patient here, he's in the acute. It is still not chronic. Okay, it is not chronic. Okay, so it is still here. So it is just hiding. So it is IgM, core antibodies. Good. Any questions? That's been good. Thank you. Thank you all. Any question before we end the sessions? Thank you for attending. We really appreciate that. If you would like, we're going to start our course soon. We're going to be happy. If you are joining us, you hear this info. We have here the telephone number. Where is here? The telephone numbers, okay. You can contact the coordinator and you can see all our posts on our website and you can email them as well. Okay, let me put another slide. Maybe it is more clear. Yes, and the last slide. Okay. Thank you. Thank you all. Thank you. Okay. Thank you. Have a good one. Enjoy the weather. Have a good one. Bye all. Bye-bye. I'm going to end the session. Thank you. Bye-bye.